Good afternoon, Virgin Islanders, here locally and abroad. I would like to thank you for joining us today for the daily update. I'm joined today by Commissioner Encarnacion of the Department of Health, as well as Commissioner Richard Evangelista of the Department of Licensing and Consumer Affairs. As usual, we'll begin today with our latest update. Sadly, we have experienced our second related death to COVID yesterday afternoon. The deceased was a 72-year-old woman who was hospitalized in St. Thomas, and she had a lot of underlying health issues. She contracted this virus through community spread and was at the hospital for some time. She had been hospitalized over the several days, but she got worse as time continued at the Roy Lester Schneider Hospital. And our thoughts and prayers go out to her and her family and her loved ones on her departing. As of this morning, we have tested 458 individuals for COVID in the territory. Out of that 458, 373 of those tests came back negative, and as we had the 51 positive, and we have 34 tests pending. 46 of the 51 have recovered, and of course we have the two unfortunate fatalities, which leaves us with 3 individuals in the territory that we are currently tracking with active cases of COVID. As of right now on beaches, our plan is to allow the use of our beaches again, starting Monday, April 20th. I know a lot of people are looking forward to that, but as we go there, and over the weekend, we know we have people who have been violating, but we want to violating the order in going in the water and going to the beaches. We really need to respect these orders as we put these things into place, not for our own amusement or to test the capability of our National Guard or our police, but it's to keep you safe and to keep your family safe. We want to open up the beaches on Monday, and like I said, we're on track to do that. But there's a little risk involved here. It seems that we are started to conduct the water testing, and just like any other institution, the labs that we send our water to, they actually had reduced their workers as well too. So we're not expecting to get back water tests until Thursday. So we want to caution the public as the beaches open on Monday that, if you're swimming on the beach, you do so at your own risk. And we also want to have another caution with the public to say, and if come Monday you decide to go in the water, try to do so in bays that don't have new boats docked there or moored there in the harbor. We're very conscious about those boats. We've been monitoring them, but we can't guarantee that everyone is compliant, and we would at best prefer to have the test done before we open those beaches or before you go into the water. But we're going to go ahead and allow the beaches to be open because that's not the case in every beach, and we have beaches that don't have boats in their harbor. But we suffer from that from the runoff as well too after heavy rains, having those beaches having high levels of E. coli. So by Thursday, we should have a report from the Department of Parks and Planning and Natural Resources that will be able to tell us which beaches are safe to swim in and which are not. And as you know, that is mostly for people who have compromised immune system. But we want you to stay out of the water as much as possible, especially in those bays, because we have enough to deal with all the health challenges we have going on in our community. I'd also like to remind you that even as we start to open the beaches, yet I'm giving all of this to you before Monday, that we remember we still have a mass gathering restriction in place. It's no more than 10 individuals together. We're going to contemplate it this weekend, but more than likely, there will be no alcohol on any beaches allowed come Monday. We will make that official on Monday when we make the decision on opening the beaches. We want to do that just because people have a tendency to congregate and stay longer on the beaches when they have alcohol. So we want people to stay as separated, stay with you or your family, your immediate family, not your auntie and your uncle and your auntie friend. You know, if you have to go to the beach, stay within your immediate family as you go there. I just want to keep you safe. And I'm encouraging you just to stay away from people on a whole. And if you know you can help yourself, stay off the beach. Some of you are really social. It's not a bad thing, but in this particular instance, we just want you to keep to yourself and stay off the beach. And it's easy, you know, because if people are not cooperating, if people are not staying off the beaches, if people are not maintaining their social distancing, we're going to just have to close them again. We have begun our discussion about reopening internally at this point, easing down restrictions and allowing people to move about because we're fast approaching our April 30th deadline. There was a document that was issued yesterday by the White House setting out a strategy or what I would call a framework for opening up. And as we look at these, at this framework, we certainly have a lot of decisions to make locally. But even on initial blush, we are well away from opening our economy. One of the things that is particularly disturbing to us is the availability of testing worldwide, but most especially nationwide. I just got off seeing an update from Governor Cuomo, who has the same problem that we have in terms of access to the reagent. That's the compound that they mix with the virus sampling in order to get us the result. So they have a serious shortage of this reagent worldwide, and New York has it, the same shortage, and we're experiencing the same shortage. And one of the things you have to open up your economy is the ability to do mass testing. So I'm going to continue to talk with the White House, talk with FEMA, have discussion with our Department of Health and their contacts to see if we can get more of this testing. We're doing well on the equipment. We have a strategy now. We're trying to create our own store of protective equipment at Vitema, because we all know that the likelihood of this coming back and visiting us again in the winter is very high. The likelihood of that is very high. Everyone is pointing to a very cautious flu season, so we're looking there. Switching gears, I've been getting a lot of concerns from the community. You know, we have a lot of resources in government, but one of the things that I'm particularly concerned about is our undocumented community. Those people in our community who don't have papers, remember, they can't work, they're not eligible for food stamps, they're not eligible for unemployment. These are families with children, very vulnerable. So we're working with our Department of Human Services to make available food for nonprofit organizations, whether churches or just nonprofits on a whole, to be able to share food with those families and make sure that they are well fed. I mean, the young people, the children enrolled in school can go and get something to eat at the Department of Education's lunch program. And any child, I'm sure we won't be denying them from getting food. We want to make sure that everyone in our community is taken care of, whether those people are citizens or they're undocumented individuals. And you know some of them, you sit next to some of them in church, you meet them in the byways as you go about your business here in the Virgin Islands. My other class that I think, my demographic that I worry about eternally is our elderly. This thing, when it first onset, it was thought it was going to be a real quick thing. Maybe, you know, we're down for 2 weeks, 3 weeks. As this drags on, you know, we're limited from contacting our elderly. I want you to make sure that you at least go by and stop by the window, say hi, stay your 6 feet. if you can, to your grandmother, or someone that's senior in our community. See if you can run an errand for them. See if you can do something for them. But try your best to stay away, because we know those are our most vulnerable population. On our side of the coin, right now, as we get in this federal money, we're looking at all the different things that we can do to make life easier for you and your family. One of those things is to be providing taxi service to and from the grocery store and delivery for our senior community. So they don't have to come out if you don't want to, and if you need to go to the store. We're going to expand the services of Vitrans, so to speak, through private entities to allow for delivery. And we'll be giving you more information about that as those funds become available from the federal government, and we are able to provide that for you. So please look out for that. We haven't really forgotten you. These are some of the things that we're doing to really address the needs of our community. Like I said, our YES program, Your Emergency Energy Subsidy, that we're still working with the federal government, looking good, to be able to give you a subsidy to help Virgin Islanders pay their light bill, because that's a real concern in our community. And then we've also been doing things to make sure. Yesterday we had a great show with our Commissioner of Human Services. You can go back if some of you have social media. We'll be running that on the public access channel as well, talking about how you access funds, whether those funds are through SNAP or MAP, Medicaid, or our other TANF, which is commonly known as welfare, those programs, making sure that you stay connected and you know that we have resources for you to access. Other things that we're doing, we're fighting down gas prices, because I know a lot of you are not traversing the highways. You're staying at home like you're supposed to, I hope. But we know there's a lot of concern around gas prices, so we brought Commissioner Evangelista in here today to share with you the work we've been doing to reduce your gas prices, and you should be happily smiling as you pass those gas prices and those gas stations. You see they're really starting to go down. We got news today that'll help you. They're going to go down further as we apply the pressure. And we're getting good cooperation from our St. Croix vendors and our St. John vendors. Unfortunately, our St. Thomas suppliers are giving us a little hard time, but we're going to be putting the pressure on in the worst way to make sure that we get those gas stations, those gas suppliers to come down with their prices. And finally, it's the end of the week, and I can't really leave here without discussing the violent crime issue that we have been experiencing in St. Thomas. It is really unfortunate when we are fighting a disease worldwide that is killing thousands of people. And here in the Virgin Islands and other places throughout the nation, we find time to kill ourselves, to kill our neighbors, our brothers, our sisters. It's a spate of violent crime on the island of St. Thomas, and it comes at a time when we as a community, we just need to work together to fight against our common enemy. It is a really sad and disappointing thing to have to stop what you're doing to come to deal with things like people shooting one another. And from some of the reports that I'm getting, shooting one another for little or nothing at the end of the day, wasting lives, not only from those people who died, but from those people who committed these acts of violence, because we will catch you. The Department of Virgin Islands, the Police Department, has done an incredible job arresting people who commit these murders, so you will not get away. I want people to really think about the loss in our community, not only of life, but all of the mothers, over 800 mothers in the Virgin Islands, who have lost their children to gun violence. It is time to stop. It is time for us to step up and start to tell people what we see and what we know. You don't have to name your name, but name somebody's name. So we have something to go on. We can bring these fugitives to justice, because it'll just keep going with the feuding and it's like Bloods and Crips forever, back and forth with the violence, and we don't need it. Rest assured that our Virgin Islands Department of Police Department, is working hard to fight crime. We had a good showing in hospital ground, but usually what happens when you squeeze a balloon at one end, it pops out at another. But we got enough officers, and I'd like to thank each and every one of those officers for going out there and for fighting this crime and for trying to keep our community to assist as much as possible. We want you to help us bring these people to justice. Like I said, you don't have to name your name, but you could tell us their name. And if you're willing to do that, I want you to call Crime Stoppers, 1-800, everybody know that. But remember the other ones, 222-8477, 222-8477, and definitely taking a bite out of crime. I'm going to cede the mic now to Commissioner Evangelista, who's going to tell you a little bit about your gas prices and what we've been doing to help your situation in the territory coming through this pandemic. Commissioner Evangelista.
Thank you, Governor Bryan, and good afternoon to you, Governor Bryan. Good afternoon to my other fellow panelist, Commissioner Encarnacion. Good day to the people of the United States Virgin Islands, both here locally and abroad. First of all, I'd like to thank Governor Bryan for allowing me an opportunity to address you, the community of the Virgin Islands, and the citizens for the many myriad of questions that have come up. We've attempted to address them via our Facebook page, but unfortunately, we are not as popular as you, Governor Bryan, so thank you for the platform today. I'd like to applaud the fuel wholesalers and retailers that are lowering their rates at this time. These lower rates will provide some very needed economic relief to the community. As we all know, COVID-19 has created many unforeseen economic hardships for persons in the community. I encourage every fuel service operator to examine its daily cost of operations and to pass on the maximum amount of their fuel product cost reduction possible to the consumers of the Virgin Islands. DLCA is meeting with every fuel retailer and wholesaler to discuss not only the impact of COVID-19 on its current operation, but also their normal day-to-day operations with the objective of helping to maintain a healthy balance that will result in price profit margins that are ultimately both fair to the consumer and the business. According to the information gathered thus far, high fixed reoccurring costs like electricity, payroll, rent, fees, and other financial operating challenges, along with the sudden large reduction in the volume of fuel being sold since COVID-19, are among the most significant factors affecting their ability to quickly reduce fuel prices at the pump. While further price adjustments are being reflected at the pump, I urge every consumer to use the information contained in DLCA's bi-monthly fuel survey and exercise your strong consumer power to purchase fuel from the cheapest source. As an example, on St. Croix, the lowest price for self-service regular and self-service premium can be found at Ziggy's Island Market, LLC at $1.99 and $2.39 per gallon, respectively. To tell you how this conversation works, as of 11:30 a.m. today, Friday, April 17, 2020, One Love Station, La Grande Princess, Golden Rock, and Hannah's Rest notified us that effective tomorrow morning, it shall have the second lowest price for self-service regular at $2.10 a gallon. I'm going to move to the island of St. John. Surprisingly, in the district of St. Thomas and St. John, the island of St. John yesterday recorded the lowest price for regular gas at Racetrack on St. John for $3.05 a gallon. Ladies and gentlemen, retailers in St. Thomas, I thank you for what you're doing, but we're asking you for more on behalf of the consumers. Today, the cheapest price on regular gas can be found at Petra's Frenchtown, Polyberg, and Smith Bay at $3.09 per gallon. Thank you. And the lowest price for premium can be found at Racetrack for $3.45 a gallon. At this point, with Governor Bryan's permission, I'd also like to quickly address price gouging in the community. Ladies and gentlemen, price gouging is real. However, I want to educate you and inform you that currently the price freeze are on those items that will prevent the spread of COVID-19. So PPE, cleaning products, toilet paper, and the like. However, I want you to know that if you believe that an item is priced more than it should be, I need you to take a photo of the item, record the name of the store, and call our hotline, which was established just for COVID-19, but we shall continue. It's called the Scam Line. In this district of St. Croix, it's 340-727-SCAM. That's 340-727-7226. And the District of St. Thomas and St. John, the scam line is 340-771-SCAM. That's 340-771-7226. Governor, may I continue?
Go ahead.
Thank you. There's also something else that Department of Licensing and Consumer Affairs would like to bring to your attention. Scams are existing worldwide, but they're also coming home to roost. There's currently a solicitation from the government of the Virgin Islands, which is fraudulent. The individual or group is utilizing the letterhead of the Commissioner of Finance, Kirk Colwood. However, there's a fake telephone number, and many businesses in the territory have already begun to receive this correspondence indicating that they're requesting donations of $25,000 or more to assist the Virgin Islands to fund research programs to find a cure and possibly a vaccine for the deadly COVID-19 virus. I want to warn you, this is a fake endorsed solicitation. It is not real. Do not respond. Contact DLCA or contact the Virgin Islands Police Department so that we can turn the information over to both the Virgin Islands Attorney General as well as the United States Attorney's Office, who are diligently assisting us to prosecute these people. There's also a very unnerving text message that has been coming out, and I'm sure Commissioner of Health, Tita Encarnacion, can help me. And the text reads as follows when you receive it on your personal telephone. Someone who came in contact with you tested positive or has shown symptoms for COVID-19 and recommends you self-isolate and get tested. Do not respond to the address that is contained following that message. I'm not going to read it because I don't want to give the persons any more credence. If you get this message, you need to contact the Department of Health on their website or text COVID-19 USVI to 888-777 or contact the scams lines. Ladies and gentlemen, it is not a joke. People are going to prey on you. The stimulus checks are coming out, and the rebate that the break you're going to get on your WAPA bill, that extra cash, you're going to think you can help someone. Before you indulge, please check with the authorities. And lastly, ladies and gentlemen, this is a public health emergency. The governor did allow the Commissioner of Licensing and Consumer Affairs, myself, along with the Department of Health, to deem what is an essential versus a non-essential business based on the general list of businesses that were put out back on May 13th. The list has not changed thus far, and I'm asking you to heed to the list that says you're either essential or non-essential. We're getting a number of calls from beauticians, barbers, nail parlors. You are non-essential until further notice. If you look at social media or even the national media, a barber, may he rest in peace, in Georgia, accepted private appointments, and he is now resting in peace. I'm sure Governor Bryan and Lieutenant Governor Roach do not want that for you as Virgin Islanders. We understand the economic plight that you're facing. However, we can always replace wealth. We cannot replace your health. DLCA shall continue to educate before we regulate, and I'd like to thank you for the community for supporting us. And if you find anything or see anything, please report it to us so that we can assist you in getting to the bottom line. Governor Bryan?
Thank you very much, Commissioner Evangelista. I want to, we've been getting a lot of questions from you on mask and usage, so we asked Commissioner Encarnacion to come on today and share a little bit with you about what we've learned from the CDC.
Good afternoon, everyone. The Department of Health expresses condolences to the family and friends in St. Thomas for the loss of your loved one from the COVID-19 disease. Our thoughts and prayers are with you in the time of grief, as it is with the Phipps family and all those who have suffered a loss due to coronavirus outside of the territory. We have been receiving some questions, as the governor stated, on the use of masks. The Center for Disease Control and Prevention, or CDC, has published guidelines on the use of face masks, and in particular, simple cloth face coverings. Simple cloth face coverings should be used to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. Cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as a voluntary public health measure to slow the spread of the virus. As a precaution, if you happen to have been infected with the virus that causes the COVID-19 disease and not presenting with symptoms, the use of a simple cloth face coverings may prevent you from unknowingly transmitting it to others. We ask that no mesh or crochet covering be used as face coverings. CDC recommends wearing cloth face coverings in the public settings where other social distancing measures are difficult to maintain. Example, grocery stores and pharmacies, especially in areas of significant community-based transmission. Please note, however, the United States Virgin Islands is not an area with significant community-based transmission. However, out of an abundance of caution, we are also recommending the use of cloth face coverings in public settings. It is important to note cloth face coverings should not be placed on young children under the age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face coverings recommended are not the surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and medical first responders. Further, cloth face coverings should fit snugly but comfortably against the side of the face, be secured with ties or air loops, include multiple layers of fabric, allow for breathing without restriction, be able to be laundered and machine dried without damage or change to shape. Individuals should wash their hands before removing. Be careful not to touch your eyes, nose, and mouth while removing, and wash hands immediately after removing the cloth face coverings. Even though we have not seen any positive cases within the last 9 days, the department has expanded testing to those with symptoms of cough, fever, and mild shortness of breath, with or without travel history. If you are experiencing related symptoms, please call our epidemiology hotline numbers 340-712-6299, again, 340-712-6299, or 340-776-1519. Again, 340-776-1519. If you are experiencing severe shortness of breath, please call 911. We ask that you continue to adhere to the stay-at-home guidelines, wash your hands, and stay safe. With your help, the epi curve is currently flat. Let's continue to protect one another. Blessings to you all. Thank you for listening and share what you have learned about here today. Thank you.
Thank you, Commissioner. I just as a side note, we are a couple of small wins, we always call them. These days, any good news is great. One of the things that we've been able to do is we now have thermal thermometers, the infrared, and we can check people's temperature coming into the territory. So that's great news there. That'll allow us to be a little bit safer, as we have identified. One of our weakest points are the airports. As you know, the airports got $40 million at the Port Authority in order to address this COVID situation, which is fantastic news. About $20 million for each airport, so that is good. Yesterday, as a side note, other things go, I had a really good meeting with the legislature. I would like to thank Senator Francis, the president. For that, we had an opportunity to discuss a number of things. I would like to let you know that your senators are working hard on your behalf. We discussed the budget, of course, and our finances, the beaches and the safety on the beaches, especially the water testing. That was important as well. Of course, our schools and what we're doing to make internet and access and also devices, computers available to our students. Of course, whether or not the construction for the recovery is going on, as even though we have this pandemic to deal with, we're trying to get as much people out on the road doing work, doing recovery work as possible. So that meeting really went well. We promised on both sides to keep the dialogue open, to get more things going. And of course, we always have our linkage to our delegate, Stacy Plaskett, over there in Washington, working hard to get us resources that we need. One of the things that came up yesterday as well, too, that we're working on here at Government House is the SBA loans, trying to encourage the repopulation of that account to get some more money, because we know, and I'd like to thank all of you businesses in the Virgin Islands. I've been getting very positive reports from the bank that you're applying for these loans, and some of you are getting approved, but I understand there's a difficulty now with the money and what's going on on a national level. So glad to hear that as well, and hopefully the President and the Congress will get it straightened out, and we'll be able to get more people working. Unemployment insurance, we're working really hard. We've added personnel now to try to get those applications in, to get that money out to you as fast as possible. I know you're waiting for those stimulus checks. We want you to get them too, because we want to see that money spending in our economy. So we're trying our best to get them to you as quickly as possible. Hang on, those are coming as well. I want to open up the floor now for any questions that the press may have for us or the commissioners. I'd also like to encourage you, the listener, if there's a commissioner that you would like to see up here, please put it in the comments. We can get them up here and avail you or get them on our live show, the press box that you need more information from. Please let us know, as we'd like to give you as much information as possible. Questions from the press? Go ahead.
Good afternoon, Mr. Governor and Commissioners. Robert Moore with the VI Consortium.
Hi, Robert.
Hi, good afternoon. My first question, sir, is for Commissioner Encarnacion. It's regarding the tragic death, the second fatality from COVID-related disease. Do we have any idea how the contracted the disease or the virus?
As the government mentioned, that was a community spread, meaning that we really do not know for sure how she contracted the virus.
Okay. And before her hospitalization, was she at home or within a senior housing facility?
She was not in a senior housing facility. She was at home.
Okay. And considering the two fatalities in the territory have been elderly residents of St. Thomas, is the department doing anything to reach out and educate the elderly population specifically to get tested?
Yes, we are. Actually, we're working alongside the VI National Guard, but more so with the Department of Human Services, who actually have a log of all of the seniors that are out there. And so we're working with them. We actually have started going into the neighborhoods, not to the homes themselves, but ensuring that we project messages to them, letting them know, not only to them, but also to their family members. And that's one of the reasons why we have the text. We ask you to text COVID-19 USVI to 888-777, and we're asking the younger population to provide the information to the older population so they too can be and stay informed.
We are also using other information that we have that identified where our senior citizens are, so we could start to GPS their house locations, not only for this occasion, but in case of a storm, that we can locate those people. So that process, we're getting the list together now and physical addresses, and then we'll be finding out, trying to GPS exactly where their GIS location is, so we could start to have, anytime something like this happens, we can quickly find people and give them the information they need. But if you listen to our talk shows, our elderly are well engaged and making their pleas heard. One of them, of course, is transportation to the grocery stores, so we're following up on that, Robert. Other question? Or you had another one?
Yes, yes. At this stage, the number of positive cases has been stable for several days now.
9 days in St. Croix.
The peak.
9 days in St. Croix. I think today is the 6th day in St. Thomas without getting any new positives. All we're getting is negatives. No, we do not exceed to any peak. We are just as vigilant as when we had one case and they were starting to ramp up then as we are now. We were predicting that our peak was going to be a little bit later on, and we're sticking with that. Number one, because we want to keep people safe and vigilant, and number two, because we're not really safe until our feeder cities, Miami, New York, North Carolina,
New Jersey.
Atlanta, New Jersey. When those states start to peak and go down, then we'll feel a little bit secure. But until then, we remain vigilant because we have such a small population that 10 people on one island could be going to the hospital. That is, we could consider that a surge. So we have to make sure that we keep it tight and vigilant. Other question?
Okay. And I'm sorry, sir. If the peak is still perhaps down the line, can you explain the thinking behind reopening the beaches, which is sort of an invitation for more people to interact?
The reality of the beaches is twofold. As we were going into the peak, we didn't want to test our luck, number one. And then number two was there's a strong family tradition in the Virgin Islands of going to the beach during our Easter vacation, especially on St. Croix, where my family and myself usually camp out. As long as I can remember living on this island, we used to camp at Coakley Bay. Now we camp at Smuggler's Cove. The tradition is so strong that people, I don't think, would be able to resist the urge, even if they weren't camping, to go on the beach and party and have food as usual. And when you get in those situations, kids are going to play with one another, people are going to share food, alcohol is going to be there, and you know how we love to have a good time. So just to eliminate that, we made sure that we did this. And then because everything now we think on 14 days, we just made it 14 days. But so our concern wasn't so much on regular time with the transmission on the beach, but it was because we were going through that long weekend and everybody was going to be at home and bored, and we know what the beach was going to look like. We've entertained discussions among our team about closing the beach on the weekends, which I argued vehemently against because it's not fair to those of us that go to work every day, and only chance may be to get a chance to go get a dip on a weekend, get a little soak and a relaxation. It wouldn't be fair to them. So, and there's a lot of people that use the beach, but I love my seniors, so I'm always thinking, those people that just want to go to the beach and do that little walk, they do a little dip, and then they go home. So we really want to give people their mental health and be able to have the beaches. I hope that everybody cooperates so everyone can enjoy our beautiful beaches and we don't mess that up. Other person, next question. That's it? That's it? All right, I want to thank everybody for tuning in as usual. Know that my prayers are with you, and I thank you for the prayers, the well wishes, and everything you sent me. I'm doing all right. You don't got to worry. I mean, I look a little worried in these things because they have these bright lights, but the team is working for you, and we have great people in the Virgin Islands, your sons and daughters, cousins, nephews, and brothers, nieces. They're your people. They're your Virgin Islanders that are out here working for you every single day to keep you safe. So I know it's going to be hard this weekend again, but come Monday, we're going to do our best to ease the restrictions on the beaches. And on the 30th, we'll take a look at what else we can do to start to keep our community safe and allow things to get back to a little bit of normalcy. Other than that, have a fantastic weekend. God bless you. God bless the Virgin Islands. And don't forget, we always have the Spanish version of this as soon as we're done. So have a good weekend.
Buenos días. Esta es una actualización sobre dónde estamos en nuestra respuesta al COVID-19. Lamentablemente, tenemos nuestra segunda muerte relacionada al COVID-19. La fallecida era una residente de 72 años de San Tomás con problemas de salud subyacentes que contrajo el virus a través de la propagación comunitaria. Ella había sido hospitalizada durante los últimos días en el Centro Médico Regional Roy Lester Snyder. Nuestros pensamientos y oraciones están con su familia y sus seres queridos. A partir de esta mañana, en el territorio, hemos hecho pruebas a 458 individuos para COVID-19. 373 de esas pruebas dieron negativo, 51 positivos y tenemos 34 pruebas pendientes. 46 de los 51 se han recuperado y 2 han fallecido, lo que significa que actualmente estamos rastreando 3 casos activos en el territorio con COVID-19. Nuestro plan al presente es permitir el uso de las playas públicas a partir del lunes 20 de abril. Quiero proporcionar 2 precauciones específicas. Primeramente, la prueba de calidad de agua no estará disponible hasta más tarde esta semana. Los bañadores de playa estarán nadando bajo su propio riesgo. Le pedimos que sea especialmente cauteloso en las aguas que han sido visitadas recientemente por navegantes. Tan pronto como pueda, el Departamento de Recursos Naturales proporcionará una actualización sobre las playas. Esperamos tener esa información para el jueves próximo. Desafortunadamente, incluso el laboratorio ha tenido reducciones de personal como resultado de la pandemia. En segundo lugar, quiero recordar al público que los requisitos para el distanciamiento social y evitar las concentraciones masivas siguen vigentes y se aplicarán plenamente. Eso significa absolutamente ninguna congregación de más de 10 personas. Los animo a mantener a su familia lo más lejos posible de la familia de los demás. Si no somos capaces de autorregular nuestro uso de las playas, no tendré más remedio que ordenarlas cerradas de nuevo. Con el fin de limitar las reuniones masivas en nuestras playas, los bares y restaurantes deben permanecer cerrados. Ayer, la Casa Blanca emitió una guía sobre la forma en que creen que los gobernadores pueden comenzar la reapertura de la economía de los Estados Unidos. Esta guía nos proporciona un marco o estrategia muy útil a medida que contemplamos esas decisiones a nivel local. Actualmente tenemos algunos obstáculos significativos en la reapertura de nuestra economía, incluyendo los recursos de prueba, que no han sido suministrados por el gobierno federal. Continuaremos preparando y proporcionando más información sobre estas decisiones en los próximos días. Estoy recibiendo una gran cantidad de comentarios sobre ancianos y discapacitados en necesidad de transporte para llevar a cabo mandados diarios. Somos conscientes de esta preocupación y estamos buscando contratar con compañías de taxis privados que puedan transportar individuos o contratar con servicios de entrega local para servicios de puerta a puerta. Finalmente, no puedo terminar la semana sin discutir lo trágico que ha sido recientemente nuestra situación en cuanto al crimen violento. Tuvimos una serie de crímenes violentos en la isla de San Tomás, en un momento en que la comunidad necesita trabajar junta para luchar contra un enemigo común. Este es un giro triste y decepcionante de los acontecimientos. El Departamento de la Policía de las Islas Vírgenes está persiguiendo agresivamente las pistas sobre estos casos y mi administración buscará plenamente la justicia de la ley. Pedimos al público que ayude a identificar a estas personas, a sus co-conspiradores y sus motivos. Si sabes algo, di algo. Si no está dispuesto a comunicarse con la policía directamente, llame a Crime Stoppers al 1-800-222-8477. Gracias.